Hi friends, this is Devendra Soman from Nisarga Herbs, and today we are doing a live session with Dr. Mahajan from Dr. Mahajan Skin Clinic. Uh, he is an MBBS, MD, FCPS, DDV from Dr. DY Patil Medical College. He is a fellow of American Academy of Dermatology. He is a fellow of European Academy of Dermatology. He is a visiting fellow at Maximilian University in Munich. He is also the recipient of K. Siddhappa Award for Best Original Research. See, Dr. Mahajan is here already, so let me just add him. So, Dr. Mahajan, he has presented over 25 research papers so far. Apart from routine dermatology, he has taken special training in dermatoscopy and trichoscopy, which means basically the scope zooms in on the skin about 70 times, reducing the need for invasive biopsy. Hello, Dr. Mahajan. Good evening and
Hello,
welcome
hi.
to our program today. All the people who are watching today. And we have a few set of questions that we have already prepared. We have received them from some of our customers, some of our clients. So we would request that you will answer those, and then we'll take questions from the audience if they have any. Go ahead.
Yeah. So I would like to thank all. And now coming to your first question regarding the function of the skin in the body health. The main function of skin is it acts as a barrier to the between the inside and the outside. It also has an important role in the immunity, in which it helps to identify and activate the immune response of the body towards foreign objects like bacteria, viruses, and fungi. Thermoregulation, that is maintenance of the temperature of the body, is also performed by the skin. Along with it, excretion and regulation of water is also carried out by the skin. Skin is commonly known as a window to one's inner health. It can be through changes in color, through changes in texture, and changes in the skin can give a lot of perspective to what is going on inside one's body. Uh, for example, yellowish coloration may be suggestive of jaundice. Various nutritional diseases like vitamin B12 deficiency, kwashiorkor, or folic acid deficiency can cause pigmentary changes on the skin. Exposure to metals like silver, mercury, copper can also cause pigmentary changes in the skin. Some drugs like clofazimine, minocycline can cause pigment alteration in the skin. Of course, there are a few diseases which themselves can cause a change in the skin color, like vitiligo, melasma, etc. Uh, Coming to the texture of skin changes are associated with aging, hormonal changes, and some diseases like scleroderma, etc. All in all, yes, I think skin is an important aspect of any medical examination, and which can help the diagnosing doctor to understand a variety of illnesses.
Okay, perfect. Thank you, doctor. So I see a few new people have joined our seminar today. So let me just go through the introduction once again. Who we have here with us at our Nisarga Talk show is basically Dr. Mahajan. He's a gold medalist dermatologist, and he's a fellow of many universities outside India, and he has done about 25 research papers. He's a awardee for the best original research. So, thank you, doctor, for giving us your valuable time to us today. Uh,
Thanks to you.
Now, basically, the seminar is based on the role of skin in spread of COVID-19 and what it can do to also prevent from the virus from taking hold of the body. So the next question I have is a very common question that everyone is facing through, everyone is going through, and that is about wearing masks. So everyone is talking about using masks, but we see people put on a mask and they have their nose outside the mask, or they pull the mask over their face and they have it around their throat, or they have it around their chin. Now, what is your take on people who use their masks like this? Can transmission happen due to this? Is the first question. The second question is, how would you recommend masks should actually be used? And the third question is, if people are not used to wearing the masks, is the mask even a valid protection against the virus?
So now research has proven for a fact that uh, coronavirus spreads through droplets. Droplets are basically small particles which come from your mouth when you sneeze or cough normally. They can also come through talking. So when a person wears a mask, he blocks the spread of these droplets from his own mouth to the body or to the face of the person in front of him. There is also a known fact that it can spread when a person brings his hand to his mouth. That is why we tell do not touch your face, do not touch your nose while when you are out in public. So definitely wearing masks is compulsory if you want to protect yourself and people around you from the infection. Now, wearing masks below the nose will prevent the spread of droplets. The droplets will spread from one person to another. So it is important that the mask should properly cover your face and your nose at all times. And one more thing, if contamination has occurred on your neck, moving the mask down and taking it back up will spread the infection from your neck to your face. Not advisable. I have also seen a few people who lower their mask while talking, and when they are on their vehicles or in their cars, they wear a mask, which is of no use. You should wear a mask when you're in public, talking with somebody, or you're going out shopping, you're going to a market, to your job, office, etc. Mask should be appropriate to the size of your face. It should properly cover your nose, your mouth, and when you breathe, the air should enter through the mask and not through the sides. Because again, if you breathe in unfiltered air, the mask will have no use. And lastly, washing your hands. You use a mask. You should not try to hold your nose or your mouth with your hands. Even if you do that, you should frequently wash your hands with soap water or use a sterilizer if available.
Okay, perfect, doctor. Thank you so much. So, I would like to get our audiences involved in our conversation as well. So, I request everyone, in case you have any questions, please feel free to put them in the comments and I will read them out to Dr. Mahajan so he can answer those. Uh, this talk is basically brought to you by Nisarga Herbs and Barwa Skin Therapy. I will be talking about the websites and how you can get in touch with us at a later point. But let's just proceed further. So, Dr. Mahajan, in your experience, which natural herbs would you suggest to improve immunity and resistance to diseases in general? Also, what would you suggest as a daily regimen for people in these hard times to improve resistance of their bodies against various diseases?
So now we should understand that infection of the skin are rampant in India because firstly it is a tropical country. The standard level of hygiene awareness among common mass is very low. Infections are of various types. They are fungal, they are bacterial, viral, also scabies, etc. are very rampant in our country. They are seen in all age groups, in males as well as females. Uh, a common question I get in my practice is when the patients or their relatives ask me, how do we improve our immunity? So immunity is can be improved by various self measures like cleaning your hands, cleaning your surroundings, wearing clean clothes. or it can be improved by use of products like syrup, immunizer, which are good for young and older patients. Uh, so, though these products do not treat the disease, but they will help you to build up your fighting capability. So, as and when you get infected, you have a good chance of coming free. And especially in kids, they are not very, cautious about keeping their hands clean or keeping their clothes clean. They go around, they play in mud. So, special care has to be taken for them. Routine products like neem, haldi have a definite role in improving the, the, the local immunity of the skin and of the body. Haldi is a known anti-inflammatory and an antibiotic agent which is used for wounds from mild cough to mild cold and for clear skin among so many indications. We also have ashwagandha, which is known to alter the level of leukocytes, lymphocytes, neutrophils. It also causes changes in immune complexes and the immune system of the body. It also has some antioxidant effect, which is helpful to the skin. Then we have Koduchi, which affects on the allergies which people face. And lastly is amla. Amla is a rich source of vitamin C. Vitamin C is widely used by all skin specialists for a variety of roles, including antioxidants, as it's a way to improve immunity, for wound healing, etc. I think these are some of the few good sources of you can improve immunity. I think that it is necessary that we should be proactive about boosting our immunity, and we should not wait for the disease to happen and then think about improving your immunity. Various use of routine household items or items which are professionally made can be used for this. I don't mean to say that herbs will prevent infection from happening, but they will definitely reduce the chance, the severity, and also improve your body's immune system so that the body can counter the infection. Apart from this, like I said, basic personal hygiene, cleanliness of your house, your surroundings, your clothes, your hands is also of equal importance as taking immunity boosters.
Wonderful. That is an excellent response, doctor. And actually, the next question is very much related to everything that you just said, especially regarding home remedies. So, the next question that we have is it's basically a repetition of question 4, but the question is what household remedies would you suggest to improve immunity? So, in that, you have already responded with haldi, neem, guduchi, tulsi, and it is a pleasure of mine to tell all the audiences as well as you that Department of Ayush, which is the Ayurveda ministry, the health ministry of Ayurveda for India, has basically chosen these 4 or 5 ingredients that you have named for frontline treatment of COVID warriors as well as patients. So we will definitely see what kind of results we get. And so moving on to the next question. Uh, the question is, should we use herbs at the house or should we buy products? So what the question basically means to imply is, so haldi and neem and guduchi can be found in household items as well. So should we buy products that are selling those in capsule or syrup or tablet form, or should we just do it at our own houses?
So now I think most of us remember our nannies or dadis who used to give us this homemade, syrup or something when we were small. So I think these herbs, these padas or these drinks, they contain herbs which are found in our household. So some practices like mixing milk with haldi, or with powder which is which or haldi and doodh we can have. Along with that, neem, which is a very good antiviral and antifungal herb, it is also used as a blood purifier. There are a lot of studies which show neem's anti-docking mechanisms in viruses, and neem also is added to bathing water as a antibiotic agent that we need to clean our body. So neem is good agent. We can use tulsi. Uh, what I feel is that home remedies are good for people where they lack resources. Like we talk about
Okay.
medicine, the modern medicine, we should keep in mind that these herbs they come in doses. So if you take excess of the dose, they can also be harmful to you, and a lower dose will not have as much as an effect as which is desired. So I think packaged processed drugs which are sold by companies which are approved by the government for prescription or for sale should be preferred over the household items.
Okay. Perfect. Yes, thank you so much for that response, doctor. I think that answers everybody's questions. In case anyone has questions, please feel free to ask them in the comment section. So moving on, uh, let's see if we have any questions from the audiences. Uh, okay, so my feed is not really showing any questions for now. Uh, okay, so let's move on to the next question. The next question is about our skin. So, people are talking about the transmission of COVID-19 through skin, through touch, through masks. But no one is talking if skin can be an effective barrier in preventing COVID-19 from happening.
Mm-hmm.
So, what would you suggest is a good daily regimen for skin care, and how would you guide us on choosing products in this highly saturated market?
So, your routine skincare should consist of cleansing in the morning, uh, routine daily use of sunscreen while you're going out and during the day, and some amount of moisturizing at the night. So, and also once a week, you can have a deep cleanse or a scrub face wash will help you. Products can be selected carefully based on the ingredients. It is better to opt for products which are natural rather than going for synthetic ones. Products should be selected based on the type of your skin. There are different products for oily skin, for dry skin, for sensitive skin, for hypersensitive skin. For that, I think you need to refer to your for your you should consult with your dermatologist for tips regarding which products to use. You should be aware of the advertisements on TV which claim fairness or beauty or something like that, or which have unrealistic achievements. There are certain creams which contain topical steroids. These steroid-containing creams can initially give you a good glow, but in the long term they harm your skin, and they cause a lot of side effects like acne, stretch marks, and so on. So I think those creams you should stay away from them. Coming to moisturizers, it is better to use naturally derived moisturizers rather than synthetic ones, as they are more acne prone. They cause acne in patients. Also, these sunscreens are recommended to be applied at least 15 to 20 minutes before stepping out in the sun. A normal sunscreen with an SPF of say 25-30 should be good enough for Indian skin. And also, if you are going to be out in the sun for the entire day, it is important that you apply sunscreen every 2.5 hours, or if you sweat a lot. No sunscreen helps you for the entire day with single application. And even if you're at home, it is important to apply sunscreens, though at a lesser frequency. And don't forget the areas of your neck while applying sunscreen, because those can also be affected by the UV rays from the sun. Uh, Coming to routine products, it is important to know about the pH of the skin. The pH of the skin is slightly acidic. The acidic pH helps it to inhibit the growth of bacteria. It also maintains the natural flora and the fauna of the skin. Now, if this pH rises due to use of wrong products or due to use of strong products, your skin can become dry and sensitive and can cause eczema-like changes on your skin. So you should know what you're using, what is the pH of the product you're using, and how your skin is basically. Some factors can cause the change in pH. So, like during the teens, when your hormonal changes are occurring, it can cause your skin to be oily. So, you need to use products which are non-oily. In older age, your skin tends to become dry, so you need to use products which can increase the oily content of your skin. There are some external factors like extreme temperatures, harsh sunlight, nutritional factors which can also change the pH of your skin. So basically, you need an all-round approach to your skin, and you should know what you're using, and you should know what effect that product has on your skin. There is also one misconception that only diseased skin requires a consultation with a skin specialist. That is not so. Even maintaining a disease-free skin does require the help of a skin specialist. So I would say get in touch with your dermatologist as soon as possible.
Perfect. Thank you, doctor. So let's take a few questions from our audiences. The first question is from Mr. Nakate. So he's saying, so continuous use of mask for 4 to 5 hours a day, does it have any effects in terms of the body immunity as well as the respiratory system?
First of all, no. Uh, Using a mask will have no effect on your respiratory system or your immunity. But make sure that your mask is clean. It should not be dirty. If you are using a reusable mask, make sure you wash it after every use in hot water with some soap. Apart from that, your mask should not affect your respiratory system in any way. It will always protect you from infection and protect the people near you from infection.
Perfect. Thank you. The next question is from Mr. Barve. So he wants to know what does N95 actually mean, because these
Mhm.
concepts are very new, but they are very generally used in these times. So if you could just brighten us on what N95 means, that would be helpful.
So there are various classifications of masks. So there is the N series, which is used in USA. There is the FPP method, which is used in Europe, and there is the KN system, which is used in South Korea. So N95 necessarily means that it filters out 95% of the air you are breathing in. These masks are recommended for frontline workers, for doctors, for nurses, for paramedics, or people who are in direct contact with COVID patients. Those need not be used by normal office going or housewives or job doing people. These should be used by, as I said, these people. And N95 is a system which is used in the US alone. FPP system is used in Europe, and KN system is used in Korea.
Okay, perfect. The next question is from Mrs. Mahajan. So the question is, can long use of mask cause any damage to the skin?
Okay. So yes, we are using a lot of patients with fungal infection who are coming to us due to the use of face mask, but they are because of use of the wrong use of masks. They are not washing their masks. They are using wet masks. They are using masks which are wet, damp, or sweaty. So it is important that you frequently change your mask. You at least have 2 or 3 masks as extras. So you can change them every day. You have to clean them with soap water every day. Do not share your mask with anyone. We are also seeing a lot of acne and pimples. That is due to these masks which have various colors in them: white color, black color, blue colors. So sometimes they add those chemicals to masks to make them fancy and attractive. So you should make sure that they don't have any fragrance, they don't have any chemicals, or they don't have any pigments in them. If you use these masks, then you are absolutely okay. You will not have any problem.
Okay. Let's take one more question. So, the next question is, how do you avoid suffocation while using mask? Mr. Sawant, who says he works a lot throughout the day and in a facility, so he has to wear his mask all the time. So, how do you avoid suffocation? Is his question while using a mask.
What I would recommend is use a mask when you are in contact with people. If you feel suffocated, you can go out into the open where there is nobody near you, and you can remove your mask. You can take a few deep breaths. It is also observed that doing pranayam, some exercise, will also improve your stamina, and which can reduce the discomfort which is caused by mask. Of course, masks will never replace the normal breathing, but they are very important to prevent infection in the present scenario. So I would ask you to go out into the open, remove the mask, take some deep breaths. You can again continue the work, but do not go around without a mask.
Okay, thank you, doctor. Now the next question is from Miss Wag. She asks if you can use the herbs that we discussed before. So neem, guduchi, tulsi, the ones that are in our households and we use them all the time as herbs or in food. Can you use them as a preventive measure against recurring throat infections?
Yes, definitely you can use them. They are supposed to be used in a moderate dose, but do not misunderstand that these will not prevent the infection. They will improve the ability of your body to fight infection, and it will cleanse your throat if at all you're exposed. But these supplements will not cannot be used instead of a mask. What people do is they have these supplements and they stop wearing masks, thinking that we are immune. So we should keep in mind herbs will help you to become stronger, but they will not protect you from transmission. They will improve the strength of the body to fight the infection. They will give you a boost in your immune system. They will give you the symptoms of the disease may decrease, but they will not prevent the infection from happening. So yes,
Okay, perfect. So,
it's
thank you, doctor. It was a very illuminating response. Let's take one more question that we have from the previous questions that we had collected. So, the question goes, how would you describe the effects on skin due to incessant use of sanitizers and cleaning products? And how do we keep our skin from drying out? And what would you recommend is a good regimen so it stays intact and is not harmed by the sanitizers?
so before that, I'll just come back to the last question, which Ms. Vargat asked.
Yeah.
So I would recommend that in the everyday you can have a mixture of these herbs, and you can have a glass full in the day or in the night whenever you want to. And doing this is also recommended, I think, by the government. If I'm not wrong, the Irish government has also released a supplement for the same. So yes, definitely
Of
that
course,
will help.
of course.
And now, coming to this question, we should understand that sterilizers are effective if they contain at least 70% of alcohol. At such a high concentration, this alcohol will definitely have skin alternative to use of such products. So what we can do is take care of our skin and use such products. So as far as soap is concerned, it is always advised to use a wide variety of soaps and choose the one which best suits you. Uh, Soaps which smell better are not necessarily good, but in fact they are more prone to allergies. Also, soaps which form a lot of lather are prone to causing more dryness, and those which lather less are milder in action. So you need to choose according to your own skin type. I think if you use a good commercially, moisturizing product for your hands multiple times a day, should uh, prevent from any adverse effect from the continuous use of these alcohol-based sterilizers. And a simple moisturizer should help you. It is also recommended to people who continuously wash their hands with soap or are in contact with soaps, like housewives, doctors, staff nurses, paramedics. They need to use a daily moisturizers for their hand and for their face. Also, I
Okay.
would like to add that when you use bad quality sanitizers, they are also more prone to causing adverse effects. So make sure you have a good branded one so that you know the side effects are minimum, and you get the best out of what you buy.
Okay. Perfect. Let's see if we have any more questions. Let me see. So, okay, so I think Mr. Mahajan had a question how to deal with dryness after use of sanitizer. So I think you have answered that question with the moisturizers. Uh, so the other thing I wanted to ask you is, do you think there is a side effect to herbs in general? So a lot of people are doing home remedies right now, and would you say there is any side effect to over consumption of herbs?
See, excess of anything is bad. Like normal drugs or medicines, herbs also should be used in a fixed dose or in a fixed frequency. You should meet your doctor and understand this dose with respect to your age, with respect to your, if you're diabetic, if you have sugar, blood pressure, etc. You should use the appropriate dose for the age, the sex, and with your health history. But I would recommend that you should not overuse any herb. A good herb in a good dose will be the best, will give you the best out of it.
Okay,
And I
perfect.
think
Thank you so much,
we are
doctor. So,
we are using this syrup. We are using ACE capsule in our day-to-day practice. So we are seeing patients of male infertility who are young in age, who have no systemic problem, but maybe it can be anxiety or it can be some sort of stress. So ACE capsules are doing wonders for these patients. I think products like these, if used in good hands, can give you the best out of them.
perfect. Thank you, doctor. So I really appreciate what you have said about herbs right now. Is that too little might not be enough, and too much might have side effects. So that
Definitely.
is why I think you prefer using products instead of home remedies after a certain extent, because that is what gives you the actual active dose that is
True.
required to have an effect on your patients, right?
Yes. And one more thing, that the taste, if you make it in your home, the taste can be bad. But if you have these commercial this thing, they taste better. They are much more palliative in form of syrups, in form of tablets, or in form of capsules.
Okay, perfect. Let me see if we have any more questions. I think we are done with questions. No one else is asking any questions anymore. So I would just like to reintroduce in case anyone just joined. I think everyone has been here for quite a bit now. But it was a privilege to talk to you today, Dr. Mahajan, in terms of COVID-19, use of sanitizers, use of masks, use of herbs. And I think it has been a very illuminating and enlightening conversation. At least on my part, I have really enjoyed the questions that you took, the questions that you answered. And I think our audiences really had a good informative session as well. So I really appreciate you giving us your valuable time. And I would like
Thank
to
you.
thank all the audience for being here for such a long time and asking questions and listening to what doctor had to say. So this edition of Nisarga Talks was brought to you by nisargaherbs.com and barwaskintherapy.com. Please do visit our website and take a look at our products. Also, we offer free doctor's consultations via WhatsApp. So in case you have any questions, please go to nisargaherbs.com and ask your questions on WhatsApp, and our team of doctors will get back to you and respond to you about your questions. So thank you once again, Dr. Mahajan. I'm very sorry for all the technical issues that might have happened before, but thank you so much, and I look forward to having you on our talk once again very soon.
Definitely, Mr. Sohn. Thank you. Thank you so much for having me.
Thank you, sir.
I'm
Thank you.
glad to interact with all of you. Thank you so much.
Yeah, take care.
Safe.
Bye.
Have a
This is Devendra Soman from Nisarga Herbs signing off. Take care, be safe, wear your mask, don't use sanitizers over a certain limit, and stay healthy. Take care of your family. Thank you. Bye.
thank you very much.